Welcome to Dewdear Academy. In this video, I am explaining the nursing tutor question paper part 4. I have already uploaded videos regarding the question paper discussion of part 1, 2 and 3 of this question paper. So please watch those videos also. So here the first question is, after delivery, which of the following medicines can be used to suppress lactation? Options are estrogen, progesterone, testosterone, bromocriptine, all of the above. Here the correct answer is all of the above. So the estrogen and progesterone, testosterone, then bromocriptine, then some of the other drugs like cabergoline, levodopa, contraceptives, tamoxifen, these are all the drugs that are suppressing the lactation. The next question. In premature labor, which of the following medicines is useful for the newborn? Options are magnesium sulfate, oxytocin, dexamethasone, testosterone. In premature labor, which of the following medicine is useful for newborn? The correct answer is dexamethasone. Dexamethasone crosses the placenta and it accelerates the maturation of fetal lungs, and thus it decreases the respiratory distress syndrome and improve the survival in preterm neonates. Partograph was first devised by options Dr. R.H. Philpott, Dr. A.L. Mudaliar, Dr. William Shaw, Dr. Shirodkar. The correct answer is Dr. R.H. Philpott. So partograph, it is a graphical record of the key data during labor, that is the data regarding maternal and fetal well-being during labor, and it is plotted against time on a single sheet of paper. It was first introduced by Friedman, that is graphically depicting the dilatation of the cervix during labor. Then Philpott and Castile developed the Friedman's concept into a tool for monitoring labor by adding action and alert lines. So Philpott and Castile added the action and alert lines in the partograph, and thus they modified the Friedman's developed partograph. Which abdominal grip is used to assess the descent of head in a pregnant woman? Which abdominal grip is used to assess the descent of head in a pregnant woman? Options fundal, lateral, pelvic 1, pelvic 2. The correct answer is pelvic 2, that is the second pelvic grip or Polic grip, or it is the third Leopold maneuver. It helps to determine whether the fetal head has descended into the mother's pelvis. Which of the following medicines is useful in the treatment of organophosphorus poisoning? Options neostigmine, atropine, magnesium sulfate, D-penicillamine. Which of the following medicines is useful in the treatment of organophosphorus poisoning? So here the correct answer is atropine. The definitive treatment of organophosphorus poisoning is atropine. In organophosphorus poisoning, there is acute cholinergic crisis that is caused by the accumulation of acetylcholine. So here the treatment for organophosphorus poisoning is atropine, because it blocks the muscarinic overstimulation and also it is an anticholinergic. Which of the following medicines is useful for reducing raised intracranial pressure? Options IV mannitol, IV phenytoin, IV diazepam, IV nitroglycerin. Which of the following medicines is useful for reducing increased intracranial pressure? The correct answer is IV mannitol. IV mannitol is used for reducing the increased intracranial pressure, because mannitol constitutes as a new solute in the plasma and it increases the tonicity of plasma. And as the mannitol cannot cross the intact blood-brain barrier, the increased tonicity from mannitol will draws out water out of the brain parenchyma and into the intravascular space. The mannitol will draws water out of this brain parenchyma and into the intravascular space, and the water then travels with mannitol to the kidney and it gets excreted in urine. So thus mannitol helps in reducing the intracranial pressure. The cardiotonic dose of dopamine is 1 to 5 microgram per kg per minute, 5 to 15 microgram per kg per minute, 15 to 25 microgram per kg per minute, 25 to 50 microgram per kg per minute. So here the correct answer is 5 to 15 microgram per kg per minute is the right answer. So dopamine, it is a cardiotonic drug, that is, it is non-glycoside cardiotonic drug, and it is a sympathomimetic drug which is used only IV. Cardiotonic drugs means the drugs that increases the cardiac contractile force during heart failure. And here the cardiotonic dose of this dopamine is 5 to 15 microgram per kg per minute. In case of hypothyroidism, which of the following is increased? T3, T4, TSH, all of the above. Here the correct answer is TSH. In case of hypothyroidism, TSH is increased. People develop hypothyroidism when their thyroid produces low level of hormones. And when the thyroid gland does not produce the enough hormones, the pituitary gland produces more TSH to compensate, or in an effort to stimulate the thyroid gland to produce more thyroid hormones, the pituitary gland start producing more TSH, thyroid stimulating hormone. So in hypothyroidism, TSH is found elevated. During hemodialysis, which of the following drug is used to prevent blood clotting? Aspirin, warfarin, heparin, protamine. The correct answer is heparin. Heparin is used to prevent blood from clotting in dialysis lines during hemodialysis. Preferably, lumbar puncture is done at which of the following site? T12 to L1, L1 to L2, L2 to L3, L3 to L4. Lumbar puncture is done at which of the following site? Correct answer is, right answer is L3 to L4. Lumbar puncture is done at L3 to L4. Which of the following is not an essential amino acid? Which of the following is not an essential amino acid? Options: threonine, arginine, alanine, tryptophan. Threonine, arginine, alanine, tryptophan. The correct answer is alanine. Alanine is not an essential amino acid. The essential amino acids include phenylalanine, valine, tryptophan, threonine, isoleucine, methionine, then histidine, arginine, lysine and leucine. These are the essential amino acid. So alanine is not an essential amino acid. Maternal mortality rate MMR is expressed in terms of per 1000, per 10,000, then per 1 lakh, then per 1 million. Maternal mortality rate is expressed in terms of, correct answer is per 1 lakh. Maternal mortality rate means it is the death of the woman who is pregnant or within 42 days of termination of pregnancy, irrespective of the site of or duration of pregnancy. So maternal mortality rate or maternal mortality ratio MMR is defined as the number of maternal death in a given time period divided by number of live birth per 1 lakh live birth during the same period. that is number of maternal death by number of live birth into 1 lakh. So here the correct answer is per 1 lakh. Eating behavior is controlled by options hypothalamus, adrenal glands, pancreas, thyroid. The correct answer is hypothalamus. Hypothalamus is the key region of brain regulating the food intake and energy balance. So hypothalamus is the answer. There are lateral hypothalamus and ventromedial. There is lateral and ventromedial nuclei of the hypothalamus. And lateral hypothalamus stimulate a person to eat greedily or hungrily. And ventromedial nuclei of the hypothalamus cause the sensation of food rejection or complete satiety. So hypothalamus is the region that is balance, that is regulating the food intake and energy balance. So eating behavior is controlled by hypothalamus. Also note that there are two parts, that is lateral hypothalamus and ventromedial nuclei of the hypothalamus. Lateral hypothalamus stimulate a person to eat greedily or hungrily. That is hunger or feeding center neurotransmitters are there. And ventromedial nuclei of the hypothalamus cause the sensation of food rejection or complete satiety. A feeling of fullness is satiety. The feeling of a food rejection or food satiety is associated with the ventromedial nuclei of the hypothalamus. Emotions can be expressed through which of the following? Options language, gesture, facial expression, all of the above. Emotions can be expressed through which of the following? Language, gesture, facial expression, all of the above. Right answer is all of the above. All these methods through language, gestures, facial expression. So through all these ways the emotions can be expressed. Thank you for watching this video.